Oh my God. Is that
a surgical towel? When did the stomach pain begin?
A couple weeks ago.
Other than the pain, any other?
Nemesis fever, sweats.
some tenderness and distension? A scar in the right lower quadrant?
You had an open appendectomy.
She had a ruptured appendix. I'm in RN.
I'm okay.
You are not. There is an irregularly shaped mass in the right side pelvic region. You need a CT stat. There's the mass.
There's a ton of free fluid surrounding the lesion.
Possible active bleeding and invasion into adjacent organs. She needs surgery immediately for resection of the lesion, multiple abscesses, and infection burden.
Oh my God. Is that
a surgical towel?
A retained surgical item?
It's a towel that was left in you after a procedure.
It is adherent to several vital organs. We could not remove it without irreversibly damaging.
Live perform my appendectomy.
But you may discuss this later. We will approach the towel like a sarcoma, perform an en bloc resection, bypass any intertwined vital arterial structures, and finish with a thorough debridement. She's not conscious. She's syncopal.
EP spiking, heart rate, possible bleed or septic shock.
Crash airway tree, and an additional abscess cavity in the towel may have ruptured. We need to get her back to the OR.
The rupture caused widespread peritonitis. This infection is way worse than before.
Aggressively irrigate, debride, and suction. Need to control the infection. Send tissue and fluid to the microlab so we can focus her antibiotics.
Big drop in BP, heart rate spiking.
She isn't tolerating surgery. We need to close her again. Sutures?
Wait, what about the towel?
We can't operate until her BP and O2 sets are under control. She'll need to remain sedated and intubated until she stabilizes, and we need to find a new approach to removing the towel.
Well, when she's closed, I can dive into research. Cutting up the towel and moving it piece by piece through a single port.
That won't work. We're stitched to the organs. The infected tissue puts her at high risk.
An aggressive gross total resection of all organs invaded by the towel, plus all infected and necrotic tissue, is the best option for long-term survival.
That procedure risks major bleeds, and we'd have to remove her uterus. You're planning a family, and Venus is supposed to carry the baby.
That will also be impossible if she is dead. We need your decision.
Is there any way to do the total resection without removing Naveen's uterus?
No.
She's dreamed of being pregnant her whole life. I can't choose this for her.
You have to make it.
Do the total resection.
Please clamp the uterine horns, grasping around ligament midway to the internal inguinal infection of the muscular layer of the uterine wall has reduced. Maybe we can save her uterus.
John, stick to the plan. You cannot save the uterus.
You are right. Necrosis is too advanced. Transfixion, sutures, and hemoclip.
We also had to take your uterus. We're so sorry.
There was no other way.
Yes, but I told them to do it. I needed you to survive because you mean everything to me. And I'm so sorry. Whatever you need, if you're out of the picture completely.
You better be here every step of the way.